Despite advances in treatment, the number of newly confirmed cases of HIV in Japan has remained flat for the past decade, a sign that misconceptions about the disease are making progress toward eradication difficult. The stigma around HIV is the reason that we can't end it. In many places, people are still afraid of HIV, or afraid of people living with HIV. We need to be clear that that idea is old, that is 30 years old. Owen Ryan, executive director of the International AIDS Society, said on a recent visit to Japan. Ryan, whose group of doctors, nurses and researchers is working to eliminate AIDS, called for more self-testing. In Japan, the key is finding those who aren't tested, he said. When people know their HIV status, they tend to go get treatment. So self-testing is important. Japan is the 5th largest donor to the Global Fund to fight AIDS, tuberculosis and malaria, an effort it helped establish. The fund is the largest multi-government funder of HIV programs, with more than $4 billion a year according to Ryan. Despite the country's efforts on the international front, newly infected HIV sufferers at home totaled 1,407 in 2017, only slightly lower than the previous year, with one-third showing symptoms that indicate they may have progressed to the 3rd stage of the disease. AIDS preliminary data by the Health Ministry showed in 2016, the number was 1,440, slightly up from 1,434 in 2015. The latest data also reported 3 cases of mother-to-child infections, the first recording of multiple infections of that kind in 3 years, prompting the government to call on pregnant mothers to make sure they get health checkups. In the fight against AIDS, the ministry started a subsidy program from April in some municipal areas in Japan, where workers will be able to be tested for HIV for free as part of their health examinations. Public health centers nationwide also offer free, anonymous HIV testing, but that's only available on weekdays. HIV/AIDS. Read full story. More help.